My name is Keith Zafren. I am 62 years old. I am married to the absolute love of my life, and we have 3 grown boys who we're very close to, thankfully, and we are super proud of. I was shocked when I was diagnosed with lung cancer back in April of 2018 because I had never smoked a cigarette in my life. I have lived a very active and healthy lifestyle. The diagnosis came out of the blue. I had pneumonia a few months prior, had a chest x-ray to confirm that, and on that chest x-ray they saw a little lump in my upper left lobe, another one in my lower left lobe. And so after a series of scans, we did a bronchoscopy in April of 2018 to do biopsies, and that's what revealed the lung cancer diagnosis. As I said, we were shocked. Really hit us out of the blue. At that time, we didn't realize how many people do get lung cancer who've never smoked, but it was a shock to us. So that led to a series of procedures. My upper left lobe was completely removed. In my lower left, they did a wedge resection to try to cut out the tumor, but still leave a little bit of the lung. Unfortunately, the surgeon accidentally cut through a little bit of the tumor, so some of that tumor in my lower left lobe was actually left inside me, which of course later became a problem. After the surgery, we went through a series of pretty intense 2 different kinds of chemo treatments for the remainder of that year. Again, unfortunately, the chemo actually didn't work. It didn't really do anything for the tumor that was left and all the suspicious nodules that were everywhere else in my lungs. So not too far into our journey, early 2019, my oncologist back in Kentucky where we lived essentially already told us that we were out of options, that they couldn't do any more surgery because I had nodules everywhere. Same reason they couldn't radiate, and the chemo didn't really work because they had determined I had 2 different kinds of cancer and 2 different mutations. So I was a bit of a complicated case, and like I said, as early as 2019, our oncologist said there's not really anything else we can do. So it was our first death sentence. We were essentially just waiting for me to get worse and die. But my wife, who you got to meet, filled with positivity, filled with lighthearted humor that kept this journey going, she said to me way back then, you just need to hold on. You just need to live as long as you can, because even though they're telling us we're out of options now, you never know what's coming down the pike. There are new medical treatments, new medical procedures being discovered all the time. She says, you just hold on and keep living, because the longer you do, we're going to find an option. Well, she was right. 2 years later, my oncologist informed us that this special drug, this EGFR inhibitor, which fit the cancer I had been in a closed special clinical trial. It was called Tagrisso. It was only available to late stage, 4th stage cancer, lung cancer patients. So I didn't qualify for that, because even though I had these 2 different kinds of cancers and 2 different mutations, it was very hard to stage me, but I was not stage 4 because my oncologist had determined that all those different cancers and mutations were all primary, meaning they had all grown on their own. None of them had metastasized or spread. So even though I had a lot going on in there, I wasn't stage 4, and therefore I wasn't qualified for that trial. But 2 years into our journey, that drug was working pretty well in the trials, well enough to be expanded outside that limited scope of 4th stage lung cancer, and it became available to early stage lung cancer patients. So my oncologist got me into that trial, started on that drug. 3 months later, I had a new CT scan, and it revealed that not only that little tumor growing in my lower left lobe, but by this time I had a tumor in my upper right lobe, which was also primary, thankfully. In just 3 months, that scan revealed that both of those tumors had shrunk a little bit from that medicine. So we were thrilled. It seemed to be working. It was working. It continued to work for a couple of years, not in the sense that the tumors didn't grow. They did start to grow again, but very, very, very slowly, thankfully, because of that medicine. And then after about 2 years, the medicine started to stop working. So on August 2nd last year, 2022, my wife and I were again blindsided. We went in to see our oncologist like we did every 3 months. We'd get a new scan, go in for review. But at this meeting, again, we were blindsided. My oncologist said to us, the tumors are growing again. The Tagrisso has stopped working. And I'm very sorry to say, but this is the end of the line for you. He said, we have no other options. If you go on palliative chemo the rest of your life, you might have 2 years to live. If you don't do chemo, probably much less. Again, this was August 2nd, 2022. That's tough news. What do you think my wife said? She said, you hold on. You just do not give up hope. I know the oncologist is saying this is your second death sentence, but we had a death sentence, she said, 3 years ago. And look, you're still here. You're still symptom free. Just hold on. So after that meeting with the oncologist, where he told us this was the end, I had already heard about what was happening here at Northwestern Medicine. I'd seen the media clip about the first 2 patients that they experimented on doing a double lung transplant for late-stage cancer patients whose cancer was limited only to their lungs. They were out of all other options. All options they had tried were not working. And they experimented because they had learned from COVID a new way of doing double lung transplants that might work for cancer. They had 2 successful surgeries. As a result, we're able to get funding for a new clinical trial they call the DREAM study. And I took things into my own hands. I made phone call after phone call after phone call to Northwestern until I finally got to the lung transplant team. As a result of that phone call, we were scheduled for an intake call with Dr. Che, the oncologist here at Northwestern. And my wife and I had quite a long call with him where he asked us a bunch of interview type questions to pre-qualify me to see if I might be a candidate for the program. This was now in November of 2022. He did pre-qualify me. He had me do 3 other exams in Kentucky to make sure that cancer had not spread to my brain or to the lymph nodes or anywhere else in my body. All those tests thankfully came back showing that was the case. So we scheduled a call with Dr. Kurihara from the thoracic surgery team, who again pre-qualified me, but very interestingly said to me, although you seem like you might be a candidate for the program, you're not sick enough for us to take you in yet, which seemed crazy. But what he meant was that I was not yet on supplemental oxygen. He said, until I am, and until my lungs are failing, I would not get placed on the donor recipient list, because of course this surgery was so brand new that UNOS list, that recipient list, the qualifications had not caught up yet to this kind of surgery. And the difficulty with this is that I had cancer. I had cancer all through my lungs, and the longer we wait to get on that list, the chance the cancer will spread outside my lungs, and then I wouldn't qualify. And I would be headed toward death. So it was a tricky time. But this again was this was December of 2022 when we were told you're not sick enough. So somehow, I don't know if it was just my will or luck or fate or divine intervention, but in January, a month after that phone call, I got pneumonia. It took me about 2-3 weeks to recover from that pneumonia, which I did. February was okay, but by March, I got pneumonia again. Ended up in the hospital at University of Kentucky, and essentially never really left the hospital after that. I had 2 rounds of pneumonia. I was discharged for only a day and got sick again and was right back in the hospital for another 2 weeks. And then during that stay is when they put me on 3 liters of supplemental oxygen to keep my O2 saturation above 90. And I never came off that oxygen. After several weeks of getting more and more sick at the University of Kentucky, the team here at Northwestern decided to transfer me here for all of those pre-qualifying procedures to find out if I really would be a part of the DREAM study. So we were discharged from the hospital in Kentucky. We went home to pack, and the next day my wife packed the car with all of my oxygen tanks in the back seat, and we drove here to Chicago mid-April this year, 2023, to do our patient education, admit me to the hospital here, and go through about 15 different tests and procedures to make sure that I qualify for the study. At the end of that, we did. They said we can't put on that donor recipient list until we move here to Chicago. So we packed the car full of all my oxygen tanks again. I was now on 6 liters by this point. We drove back to Kentucky, and we packed up our entire house to move and put it on the market for sale in 2 weeks, which my wife did the lion's share of that because I was on 6 liters of oxygen. I was coughing constantly, spitting up mucus, and tired. Our youngest son came over every day during that time period to do all the manual stuff that I just couldn't do while my wife packed everything. And in 2 weeks, we left. We drove to Chicago on May 15th, moved into our little apartment in the sky. And by June 4th, I was placed on the donor recipient list here. And then the wait, the long, long wait began. We had been told that it was about a 2 to 4 week average wait time. So we had our hearts set on that. Once it went past 4 weeks, it just got really tough. And, honestly, I wasn't sure I was going to survive. I was now on 9 liters of oxygen at rest, barely keeping my oxygen above 90. I was coughing constantly. My wife said it was like a mucus factory because I was spitting up all the time, carried what we affectionately called my spit cup everywhere we went. And I was literally dying. 6 weeks ago I was dying. Now get this. Remember, August 2nd, 2022 was the day our oncologist said it's the end of the line. You don't have long to live. 1 year later, to the day, August 2nd, 2023, we got the phone call from Morgan, our lung transplant outpatient nurse who had guided us through the whole process since April. She called on August 2nd and said, come to the hospital. We have beautiful, new, healthy, young lungs for you. So it felt divine. We came to the hospital at 5 p.m., had my surgery, the 7.5-hour surgery the next day, August 3rd. And here I am at the time of this interview, exactly 6 weeks out of surgery. I am breathing beautifully. I have energy. I'm healing. It's literally a miracle. I know that was a long story, but it is our story, and I'm so, so grateful to be sitting here after 2 death sentences, alive and well and ready to live the rest of my life. thanks to these brilliant surgeons and doctors here at Northwestern. I'd like you to see two pictures. This first one is in the step-down unit the day that I was discharged from the hospital 11 days after my surgery. You see the bell. They have us ring this bell before we leave the hospital as kind of an announcement that, we're getting out. And the most amazing thing is that it's right there in front of the nurses' station. And when my wife and I there rang the bell, all of the nurses are clapping and hooting and hollering and celebrating. And it was just such a nice homegoing. And you can see how happy we are. You can also see my shirt that my wife bought for me to wear on my day of discharge. I don't know if you can read it, but it says, "Lung transplant survivor, forever grateful to the organ donor hero who saved me." Ah, what an awesome shirt. And I'll just mention that, about a week after I got out of the hospital, I was able to write a letter to our donor family. The only thing we know about my donor is that he was a young man. So a family lost a son, and that's, with organ donation, it's a little complicated all the time because there is this amazing gift of life to me, and yet in order to make that gift, somebody lost their life. So in our letter, we wanted to express our tremendous gratitude for this gift, but also our compassion toward the family who, in their loss and their grief, made a decision to save another life. Pretty amazing. The second picture, I just think, tells the whole story. About 3 weeks after surgery, we went in for a normal pulmonary clinic visit, and my nurse practitioner put these two scans up on the screen next to each other. The one on the right is my CT scan of my lungs from April of this year, and you can just see, even to the untrained eye, how cancer-filled those lungs are. All the cloudy white, all of those white spots that are tumors. When I saw that, I thought, how was I even breathing? That's why there was that need for all that supplemental oxygen. The picture on the left is 3 weeks after surgery. My beautiful, clean, healthy, still expanding lungs. And you just look at those two side by side, and that picture absolutely illustrates the miracle that the surgery is and the hope that so many more people are going to have because of what they're doing here at Northwestern. Yeah, I think I kind of touched on that just now, how I needed so much oxygen 24/7. The coughing, the mucus, the difficulty doing anything, the lack of energy, and all of that is changed now. No supplemental oxygen today. I'm thrilled, I'm happy, I feel good. There are up days and down days. Today happens to be an up day, so I'm very grateful that happened on the interview day. But there are days where I'm just so tired, I'm napping 3 or 4 times a day. And I just talked to my nurse about it this morning, actually, and she said that is totally normal, that they literally cut me in half. They do this, they call it a clamshell opening. They put me on heart and lung bypass, take both lungs out, clear the airways, put 2 new lungs in, and then stitch everything back together. They cut the venous nerve, they cut my sternum in half, nerves. It's major stuff. And so even though I'm doing, really well on the outside, my incision is healing beautifully. I got all my staples out 2 weeks ago. Such a relief. There's a lot of healing that has to go on inside my body still. And, sometimes it's just, I'm exhausted from it. Sometimes I'm in a little bit of pain still, but for the most part, I'm not, and I'm really only taking Tylenol for the most part, a few other pain meds sometimes. But, again, I don't think there'll be anything I can ever complain about the rest of my life. It feels like I'm a walking miracle.